we covered some of these expensive items like implants, for example. In California, they can go anywhere from $3,000 to $8,000. Our next highest competitor, I won't say who they are, their contracted rate for an implant is $4,000. They only contribute $1,500 towards an implant. So 50% up to $1,500. So you take that 4,000, but that's the contracted rate minus the, $1,500, you're down to what, $2,500. Well, our contracted rate alone is $2,250. Oh, by the way, they don't have a waiting period. So our contracted rate alone on that implant in California saves them more money than our next, best competitor all in. So, sometimes no waiting period. It's not always a bargain. It doesn't always save them the money. We have affordable options that, are designed to, meet your client's needs. So we have multiple plan designs. So that way they can pick the plan that best suits their budget. The enrollment with your unique broker link. So clients can use that unique link to enroll themselves. You can share your link on social media, on your website. You can email it to them. But that link is what's going to connect your commissions to that sale. So on your broker partner link, you're under there. It will always say Benavest in it, and then it's going to have your broker number at the end of it. And that's how we know that you made that sale under Benavest, so we know what portion of commission goes to whom. Once the member enrolls, they can get into our member portal where we have the cost estimator tool. The cost estimator tool allows them to pull up any needed services. So say they need a root canal. They can type in root canal. It's going to pull up 5 providers that are in network that provide that service. It will show them what their contracted rate is and what their financial obligation is before they get the work done. So it really helps them plan ahead to know those costs that are coming up. Now, the one thing I tell people, though, is a treatment plan is something they should ask for from their dentist with any of our plans, because a root canal is never just a root canal. It's anesthesia, it's office visit, it might be exams or special x-rays. So we don't want them to just rely solely on that. Or like if they need a crown, is it porcelain? Is it titanium? It opens the door for a conversation. We'd like to put it back on the dentist because we're not dentists. To say, why do I need a titanium? Why can't I go with porcelain? But once they get the work done, then they're stuck. They're going to have to pay that bill. And, we don't want our members to, have any shock and surprises. So how much can members save with dental insurance? So we wanted to, be able to give you an overall example. So this first example, these are with our PPO premium plans. So the first example is one adult. They got 2 routine cleanings, exams, and billings. So the cost with insurance is $488, but without insurance, it's $820. So they save 40% with having Delta dental coverage. The second example is 2 adults, routine cleanings, exam, deep cleaning, teeth whitening for each person. The cost with insurance is $1,792 compared to $2,620 without insurance. So it's a 32% savings with the PPO premium. Sorry, the first one was on the basic plan. The second one's the premium plan. And then on the premium plan, a family of 4 with routine cleanings, 4 fillings, and braces for a child. $3,762 with insurance compared to $5,680 without insurance. So a 34% savings. I do want to add that we are one of the only carriers that covers braces for adults and children. A lot of companies only cover for under 18. So that is a really good selling point. So why do I need, dental insurance? So this is some things that you can, kind of pose to your clients. How much would this cost if you put off this decision? Protect your family well-being by keeping up with your oral health care, because of course, early detection is the key. This is why, we cover preventative and diagnostic services on day one. There's no waiting periods there because, we want to prevent you from needing major services later. Not saying it's going to, but, early detection, your oral health is important. You don't want to have a lapse in coverage because a lapse in coverage resets waiting periods. It just can cause a lot of problems, and then if you have a toothache now, it can cost you more later. And then financial peace of mind, because you just saw on the previous slide how much, dental insurance can save you. And in a lot of cases, our contracted rate alone, sometimes that savings can pay for their full annual premium, $500-600. So it's like it's not costing them anything, as opposed to just walking into the dentist office without insurance. But you can't sit there. It's kind of like if you get car insurance and get in an accident, and then you call up your car insurance company and say, "Well, I want this coverage, and now I want you to pay for all of the damage to my car." You can't call after the fact